And I've noticed a lot of changes since we started the ACE unit here on 5D.
I'm sorry.
A lot of obviously the care is centered around care for the elderly, which I've noticed in ambulating the patients, in their bowel regimen, and also the need for Foley's. And also even just getting up to the solarium for meals, I think has really made a difference in their care and how we treat elderly patients different from our non-ACE patients.
What I have observed here, I do a lot more ambulation, range of motion, and social activities for the elderly.
Another thing I like about the ACE unit is the community dining. That really helps with getting the older adults to eat. Having the CNAs there to help, just maybe opening the cereal box, opening the milk carton, really helps with them getting the patients to eat, and also having the social background there. When patients don't eat, they see other patients eating, they'll tend to eat a little bit more too.
My favorite story from the ACE unit was actually a patient who came from us from another unit, was on a schizophrenic drug, and he progressively had gotten weaker, and so was transferred to us to try to mobilize him a little bit more. He actually failed his swallow evaluation test and was getting evaluated for a PEG tube placement, of which would really complicate his discharge because then apparently other places would not take people with PEG tubes, and so we really evaluated his medications. I contributed my part, and we wanted to switch into something else, quetiapine instead of risperidone, and we did over a 2-week taper. And after 2 weeks, maybe it was the quetiapine, maybe it wasn't, but from being totally bedridden, he started walking and talking and started swallowing. So he actually didn't need a PEG tube, and he was out the door within a couple weeks.
So I just wanted to tell you a little bit briefly about what I usually do during the rounds. So before the rounds, I review the history and the reason why the patient was admitted, and then I do a focused interview and physical exam. And really for ACE is to kind of maintain patients' level of independence throughout their hospitalization. So the ACE is, as you know, an interdisciplinary approach to care, so I help coordinate, and I really think that this gives us a sort of a 360-degree picture of what the patient's needs are, and then we can, be more focused on designing approaches to address the unique needs.
I find myself being a lot more proactive, which is nice. It's nice to participate in prevention of potential complications that are quite common with older adults. Usually my role in the hospital has been more reactive, responding to deficits, but in this role I can actually prevent complications that occur in a lot of facilities related to just being an older adult in the hospital. It allows me to emphasize my role as an occupational therapist in considering the entire patient and not just treat them like a total hip replacement, but to consider all parts of their body, and again to prevent any complication that could occur to those specific parts, such as decreased breathing status or potential for skin breakdown, UTIs. I can help be one of the many voices that calls for get rid of the Foley, get them out of there.
I think the biggest change for me working with the ACE team is not only the rounds in the morning, but the communication between the nurses and the doctors has definitely improved. It's very nice to sit in the mornings and listen to the nurse give reports, because they're with the patient for so long, and we just get a picture, a small blip of their life. But to actually spend time communicating with the nurses, you get a better picture of what's going on with the patient, and it helps with discharge.
I work here at 5C. I'm one of the nurses here on 5C. So taking care of older adults, it really changed not just my attitude towards the elderly, but also it enhanced my knowledge, like what are the normal changes that occurs during elderly, and it is really a helpful in addressing their needs, and it enhanced my attitude and being an advocate for the elderly patient. And thank you for supporting the ACE unit. Thank you.
And we very recently had a case where a patient was admitted to the floor. She had heart failure, and the doctors had ordered a Foley catheter, and the nurse, when they saw the order, rather than what I think they would have done a few months ago, which was to place the Foley catheter, they called the doctor and told them that they were really confident that because this patient was ambulatory at baseline, they'd be able to get her out of bed and use a bedside commode. And that's what they did instead, and we averted a Foley catheter, maybe a urinary tract infection. So seeing changes like that has been something that has been really exciting.
Because the patient was demented. He had urinary retention. He was getting straight catheterized every 4 to 6 hours by the nurses. And he had refused the earlier one, and by the time it was time to catheterize him again, he had become very agitated. The doctor came to the patient Haldol and then restrained him so that you can do the straight cath. And the nurse said, how about if we try it my way first? And if that doesn't work, then we'll do it your way. And the doctor said, okay. So she gave the patient some snacks that she knew he liked and diverted his attention from what was going on. Then she got him up and she took him for a walk up and down the hallway until he calmed down. Then she laid him on the bed. She was able to do the straight cath. He did have over 1,000 cc's in his bladder, which was probably why he was so agitated. The doctor then came to the nurse and said, what a fantastic...
really people putting their heads together from different disciplines to figure out how to take care of those patients. But certainly, I guess from our residents' perspective, it just seems like magic, whatever's happening over there. So we really appreciate all the work that you guys are doing, and we'd love to see more of it happening in the hospital.